1. Hip bone, femur, tibia, fibula, patella, tarsal bone 7, metatarsal bone 5, or phalanges 14. Ever hip bone, first bone in lower extremity, that is hip bone, irregular bone, constriction in the middle it is divided into 3 parts. This acetabular cavity, above the acetabular cavity, this expanded portion is known as the ilium. Below and behind the acetabular cavity, this portion is known as the ischium. And below and in front of the acetabular cavity, that is known as the pubis. Now the ilium, it has upper border known as the iliac crest, anterior end known as the anterior superior iliac spine, posterior end that is known as the posterior superior iliac spine. Below 2 inches, the posterior superior iliac spine, that is known as posterior, this projected portion is known as posterior inferior iliac spine. And below the anterior inferior spine there is a notch, and below the notch this projected portion is known as the anterior inferior iliac spine. Now the anterior border from anterior superior iliac spine up to the acetabulum, that is known as the anterior border, superior border or iliac crest, and this one is the posterior border. Now in the medial pelvic surface, inner surface, there is another border that is known as the intermediate border. Now the pelvic surface, gluteal surface by 3 gluteal lines. This one is the posterior gluteal line, this one is the anterior gluteal line, and this one is the inferior gluteal line. Divides the gluteal surface into now 1, 2 and 3 parts. And from the posterior surface, a gluteal surface just behind the posterior gluteal line, origin of gluteus maximus. In between the posterior gluteal line and anterior gluteal line, origin of gluteus medius. And below the anterior gluteal line, that is gives origin to the gluteus minimus. And above the acetabular cavity, roof of the acetabular cavity, origin of the reflected head of the rectus femoris muscle. Now inner surface by intermediate crest divided into anterior iliac fossa gives origin to the iliacus muscle. And this portion in the articular surface, there is auricular articular surface, this rough portion for origin for articulation with the auricular articular surface of the sacrum, that forms the sacroiliac joint. Clear? Now the posterior border, below the posterior inferior iliac spine, this notch is known as the greater sciatic notch, and this lower margin of the notch continues downwards as the ischial spine, this pointed portion known as the ischial spine. Now the ischium, it has body of the ischium and ischial tuberosity, and this ischial tuberosity, there is quadrangular area by the transverse ridge. This portion is the quadrangular and this portion is the triangular area. This quadrangular area again divided into by the oblique ridge into upper lateral, lower medial area. And this triangular area is divided by the vertical edge into lateral part and medial part. And this continuation of the ischial tuberosity is known as the ischial ramus. Now the pubis has the body, superior ramus and inferior ramus. And body has anterior surface, posterior pelvic surface and symphysial surface. And this surface articulated with the same fellow of the opposite side and is interconnected by the fibrocartilage. And that forms the symphysis. That's why it is known as symphysis pubis. And anterior surface gives origin to the adductor longus, then adductor brevis and the gracilis. And upper portion, that is known as the superior ramus of the pubis, it has upper border, anterior border and inferior border. And this surface, anterior surface in between the upper border and anterior border, this is known as the pectineal surface. This one is the pelvic surface. And inferior surface, that is grooved, and by the membrane in the obturator foramen, this groove is converted into tunnel, that is known as the obturator canal. Clear? And this acetabular cavity, there is a notch that is known as acetabular notch, and margin of the acetabular cavity connected with the cartilage, the ring of the cartilage, that is known as the hyaline cartilage, that is known as the acetabular labrum. to deepen the cavity of the acetabulum or accommodation of the head of the femur. Clear? And this notch, there is margin of the notch connected by ligament known as the transverse acetabular ligament. This is about the acetabulum and general features of the pubis, ischium and the ilium. Stop.